everyone, happy evening, a very good evening. I hope and I believe all of you are doing well, guys, post exam as well. First, give me a quick nod whether I'm audible and visible so that we can start with the session. All right, that's great. I think you guys can see me not doing well. Please don't say that, guys. I mean, just be happy that you have given your best shot. And I do agree that the paper was eccentric this time. It was not like the regular NEET PG paper. Right, so I can give you that assurance कि paper थोड़ा सा weird था. So be happy कि ठीक है, हमारी गलती नहीं है. You can give that excuse. You have tried your best. So just be happy about that. Okay, and do not leave the hopes till the time the result is declared. You never know, because these competitive exams are actually comparative exams as well, how the other students have performed. So you don't know how others have actually performed, right? Many times everybody thinks that I have marked the right answer, but in the actual answer key, the answer is different from what we think, because the recalls might not be very authentic and we get biased. We try to think that मैंने जो पढ़ा वही सही था और उसके हिसाब से वो answer था, but the answer is different, right? So trust me, do not leave any hopes till the result is declared, and we hope that the result should be there in the next 10 days because already the exam was conducted late. So the result should be there sometime soon, right? So all you need to do in this while, I know that first before the exam we are worried कि एग्जाम कैसे होगा, पेपर कैसा होगा. Once the exam is done, then we are worried that result कैसा आएगा. Once the result is there, then we are worried कि मुझे कौन सा ब्रांच और कौन सा कॉलेज मिलेगा, right? So that's a cycle which goes on, it never ends. All you can do is just get that worry out of your life, because some things are actually not in your control, right? Now you cannot go back and change any of the answers, even if you feel bad about the silly mistakes that you might have done. But just accept it and move on, right? You cannot change it. So like I always tell you that if you are worrying about something that you cannot do anything about it, it does not make any sense worrying about it, है ना? So do not waste your energy about that, right? And I can give you a very authentic recall and opinion for the morning shift. Evening shift, as far as the students are saying, it was very tough, but I really don't know, because as I said again, it depends on how much was the preparation of the students who are giving the opinions and all of that. But so we'll try to compare the morning shift and the evening shift. We are not doing any like dedicated recall of the questions here. This is just a very informal session for all of you to give you that place to vent out all the feelings that you have post exam amongst yourselves with me, right? So we'll do that together, and that's what we are here for. So very good. Sachin is saying 188 correct, so that's going to be super awesome. Sachin will be waiting to hear from you post results also, है ना? So let's try to compare this, guys, and do let me know whether you feel the same about this. So how was the morning shift and how was the evening shift, right? So the difficulty level, as I said, both the shifts I feel were a bit eccentric as compared to the previous NEET PG exams that have been there. I would also agree that yes, they were like the INI-CET papers जो हमने recent years में देखा है. So the difficulty level, I would put it as moderate, and maybe the evening might be more tough until and unless I see all the questions. Okay, so I'll just put it as moderate for both. Okay, highest weighted subjects for the morning, definitely the highest weighted subjects. There were a lot of questions from surgery, and that too like some eccentric questions were also there. Then there was OBGY. In the systems, particularly hematology was also high weightage there. And in the evening session also, surgery and OBGY, there were a lot of questions on that, and even in that the OBGY seems to be difficult as far as what the inputs we are getting from the students, right? Now what subject was particularly difficult in the morning? So per se I felt that the radiology images were difficult, and they are something that MBBS graduate students should not be expected to know. What should be expected from the MBBS graduates is to know some emergency diagnosis that should be done on radiology, but not some weird diagnosis that is asked, right? So like that question of arch of aorta का stenosis है कि saccular aneurysm है कि coarctation है कि क्या है, right? So that was also a bit confusing. Personally I felt on that. And even for the fracture which was asked, the vertebra cuff fracture, whether it was compression fracture, chance fracture, burst fracture, right? So to identify that, the difference between the compression fracture, chance fracture, compression fracture does not involve the posterior element, but the chance fracture does. And there was the posterior element fracture also which was shown, which puts the answer into chance fracture, right? So these are some things, that is not actually expected from a MBBS graduate to know itna detail mein. So radiology definitely was tough, and the same input we are getting from the evening batch students as well, that yes, radiology was difficult. Okay, radiology was difficult there, right? And let me just have a quick look at the live chat. Am I able to see that? Okay. देखो, please do not feel bad when I tell you some answers and you think like, अरे मैंने तो ये mark नहीं किया, मेरा ये गलत हो गया. It's absolutely fine. Just take it as a learning lesson. पता नहीं, whatever you learn, wherever you learn, that might help you in the future anywhere, right? Even in your practice, it might help you. I'm pretty sure that whatever you learn after making mistakes, you remember it for lifetime. Like I tell you that whatever mistakes I've made in my PMT also, like so many years back, or even in the All India PG that I've given so many years back, I still remember, because when you make mistakes, you learn. Okay, ठीक है. So देखो, learn सिर्फ exams के लिए नहीं होता है, learn practicals के लिए भी होता है, for your practice also. So do not learn everything for exam only. Coming to IBQs, there were a lot of image based questions in their exam. Definitely were there, right? So for example, a lengthy clinical stem was given, and along with that, the fruit bat image was given, right? So in the morning particularly, I felt that images along with the clinical clues, they help together. If you could not identify the image, the clinical clue was very important to help you come to the answer, right? So IBQs were definitely there, but again, the clues in the question did help you to solve those questions as well. Right, so for example, that image of CHPS ultrasound in the morning shift, 6-week-old child, right? That was a very important clue there. कि 6 weeks पे presentation हो रहा है, vomiting है. So you think of CHPS in that case, right? So very important there. And now PYQ repeats. Personally, I felt that morning. Yes, there were some PYQ repeats. If not PYQs, the PYTs were definitely there. But along with that, there were some very eccentric questions also, like never heard kind of questions which were also there. The new questions which were also there, जैसे बी पाल रेजिमेंट का क्वेश्चन पूछा गया था, या फॉन विलीब्रैंड डिजीज के टाइप्स पे डिटेल्ड क्वेश्चन था, और then the question on the type 1 diabetes ka staging. So the topics are definitely the ones which are the most frequently asked topics, but when you come to the options and when you come to answer them, that is what makes it all confusing, right? And so that is the input here. And length, remember, I felt that, yeah, the questions were lengthy, right? There were a lot of clinical STEM questions which were there, but reading the last line, if you knew that trick, it definitely saved a lot of time. So the same lessons that we learned from the INI-CET exam, that these exams are definitely a test of your knowledge, a test of your memory also, how well do you retain the stuff, and a lot about MCQ solving skills also, like, how do you rule out the options, how do you make a logical guess, or, how do you make the use of common sense when you are answering the question. So for example, the question on in the morning shift on, the PCP and DT wala, ki sex determination ke liye the patient is asking, so what should the radiologist or sonologist do? Logical is, if I am doing an ultrasound as a radiologist, it does not mean that I will not look at the sex of the baby, right? If I don't look at the genitals, how will I make a diagnosis of any anomaly which is there? Any ambiguous genitalia, how will I identify? So that is going to be negligence on my part if I don't look at the genitals as a radiologist. So I definitely need to look at the genitals, and that indirectly means that I'm looking at the sex of the baby, but then I'm not supposed to disclose it to the patient. So this was a logical question, but the way the question was framed, for someone who's an MBBS graduate and reads that question, it looks difficult. But actually it was a logical and a question which could just be solved by, using the common logic there, right? So that is what I learned, guys. As I said, for the morning shift, definitely I can give you the authentic opinions there. Evening, I'm just relying on you guys, right? Yeah. So, so these were the inputs that we got, and the learning lessons that we have from this, like I said, is learning in a way that helps you retain the stuff is very, very important, right? Some topics you would definitely be asked in depth, so getting your foundation correct, getting your concepts correct is very, very good. Along with that, the tricks that help you retain the stuff, so that if you do not revise anything one day before the exam but you are still able to answer the questions, that is also very, very important. And other things, I did see some comments also on whether rapid revision helps or does not help. Rapid revision definitely helps, because that is something that has been concised by all the educators on the PrepLadder platform, putting into the most important topics that are asked. Remember, you cannot afford to make a mistake in the topics like जैसे ECG का क्वेश्चन पूछा गया है, आप उन सब क्वेश्चंस में गलती नहीं कर सकते, right? So you have to master the topics which are very frequently asked. Then you have to couple it with your MCQ practice, like the Qbank practice. That is what we all need to learn there. है ना? Biochemistry, I think was very, very easy. The question on Gauchers, which is always the favorite, which was there, right? Cataract दिया था, galactosemia वाला था. So a lot of questions in biochemistry were clinical based, and the metabolic disorders which were asked. Lipoproteins did rule, like the LDL receptor defect, hypercholesterolemia वाला जो पूछा गया था. Second जहाँ pancreatitis दिया गया था, ApoC2 which activates lipoprotein lipase, right? So all this, again coming back, if your concepts are good, your foundation are good, you learn it the right way, right? You are going to crack this exam. So concepts, foundation, coupled with rapid revision, coupled with your Qbank practice, that too the clinical Qbank that we have. So I think that definitely helps you to sail through these exams. Yes, Annette Mary George, absolutely, right? So concepts along with mnemonics, because mnemonics save you from the number of revisions. So it helps you save the time when you are actually learning stuff, right? So I think the same would be true for second shift. Some of the questions that I got to know for the second shift, like there were questions on nerve injury in anatomy, और ठीक है, रोमोवैक ड्रेन वाला जो क्वेश्चन था, या वीनस अल्सर, टाइप ऑफ अल्सर वाला क्वेश्चन था. सो व्हाट वी लर्न इज the topics are definitely repeated. It is just that the way the questions are put forward that makes it look confusing. Like for example, HDI wala question. HDI was asked in the morning shift, PQLI was asked in the evening shift, right? I believe there was coin in esophagus in both the shifts. It was not actually the coin in esophagus in the morning shift. The double ring sign, जो button battery का foreign body का पूछा गया था, INI-CET repeat question है वो. We have discussed in radiology that double ring appearance, that beveled appearance, right? So that is what was asked. ठीक है? And if you ask me about the section wise the blocks, there was aggregation of subjects, right? So for example, in the block 1, there were a lot of questions which were only like anat, biochemistry, FMT, microbiology. Then the other shift had ENT, which was put in there. Medicine, for next वाले में सब clinical subjects है, medicine, surgery, OBGY, peds was there. So there was clubbing of the subjects where you saw that one particular subject is there in one section. Few subjects did have an overlap, like PSM particularly was in section 1 also, block 1 and then block 4 also. But majority of the sections did have the segregation of the subjects is what I also noticed there. Right? Yeah, the anterior mediastinal mass question, the CT image, you had a patient of myasthenia gravis, right? So that's going to be thymoma there. Yes. MI, cardiac biopsy, lymphocytes. I think that's a repeat from your previous NEET PG exam question as well, where lymphocytic myocarditis has been asked in the previous, the blue cells, if that was the same image repeated. Right, it's a repeat question, right? Any other inputs, guys, or any other feelings that you have regarding the exam and you would like to share that we have not covered? Till the time you give me the inputs, let me also tell you the biggest news happening on the PrepLadder platform, where we are launching Rapid Revision 6.0. I hope this is not for you guys who have given the NEET PG 24 exam. We definitely want to see you on the other side. But for the students who would be starting afresh for FMG, upcoming FMG, INI-CET or NEET PG 25, for them, we are launching the Rapid Revision 6.0 on 16th of August with English video lectures also, right? So we are back with the English video lectures. And so what's in it for you is you have 260 plus hours of video lectures where you can toggle between English and English. It has the most important high yield MCQs that are like must do, at least the minimum that you should do, right? And then you have the concise notes for quick revision where we have also tagged which are the PYQ questions, right? So for someone who's starting for upcoming INI-CET exam, I would definitely recommend that you start with the rapid revision 6.0 because like I said, you do something that you can revise. Do not please put in a lot of your time and energy into doing something that you will never revise because you'll be back to square one, right? So you can start with the core, that is rapid revision, and then keep building upon for the areas which you think that have not been covered in detail but have been asked in the previous years, which is very less likely to be there. But still, then you can refer to the main notes only for those topics. Okay. RTA question, right? Was there a question in the second shift RTA ki hyperkalemia kisme hota hai? Hyperkalemia RTA, that is RTA type 4, right? There was something related to pH also. Then in the morning shift, there was this question of high anion gap metabolic acidosis. Even if you did not pay attention to compensated respiratory alkalosis, there was only one option there, metabolic acidosis with high anion gap. एक ही option था उसमें, right? So definitely that was the answer there where you were given values to calculate the anion gap also. The pH was less and everything was given there, right? What else did we have? Divyansh, I'm super proud of you that you did stand up for yourself and you got your seat changed with all those difficulties also. गोल कोई फर्क नहीं पड़ना. You might feel that it will make a difference, but honestly, कोई फर्क नहीं पड़ना. Remember, outliers don't make your difference. Yes, ready. देखो पेपर बहुत ज्यादा टफ नहीं था guys. If I have to be honest with you, I know that probably you might not like it, but honestly the paper was not very tough, but the way it was put, like there was those funny elements also, like WhatsApp ka message ka screenshot was given ki your friend is asking you an opinion on this, and instead of giving that in the question, they give you the image of the WhatsApp conversation with the friend, right? So ऐसे कुछ eccentric type से questions पूछे गए थे in a very funny way as well, right? So I mean it did have some eccentric elements as well. Yeah. Okay. So the one question in pharmacology where a lot of you have a doubt कि ADHD का जब question पूछा गया था SNRI का, इसमें सिर्फ how could you have guessed? The answer is जब SNRI पूछा था, SNRI, SSRI जो है, rhyming with that was reboxetine. Right, rhyming with that was reboxetine. So even if you did not know the answer here, just एक तुक्का जब मारना है तो logical guessing करके you can increase your score. So like I said, the MCQ solving skills is actually being tested in the exam, and it's ऐसा नहीं है कि जिसका रैंक बहुत अच्छा आया है मतलब उसको सब कुछ आता है, but that's definitely true that जिसका रैंक अच्छा आएगा यानी उसके MCQ skills बहुत अच्छे हैं. Right? So SNRI for ADHD, reboxetine was there. Multiple myeloma drug which causes herpes zoster reactivation, the answer there was bortezomib. Right? The answer there was bortezomib. Lignocaine, loading dose we know that loading dose is volume of distribution पे depend करता है. Right? So there were topics which were known, but like I said, the questions were put in a different format. It was bortezomib for that. है ना? So yeah, I honestly don't know the answer to that. वो जो रोटी चावल वाला इमेज, थाली का इमेज दिया गया था, and that activated our taste buds in the exam. थोड़े से weird eccentric questions से. Vecuronium reversal is the same repeat from INI-CET. The recent INI-CET exam had a question on that. Sugama dex, right? Rocuronium, vecuronium के लिए Sugama dex use करते हैं. Correct. Yeah, definitely it was not like the last year NEET PG exam was definitely easier than this year is what I would say. It was not like straightforward. But I still feel that the cutoff this year also will be high, considering all this while the champions test वगैरह में we have seen the scores of the students where we think that the paper is difficult, but there are students who really excel in that, right? So I do feel that the cutoff will be high. It's not going to be a low cutoff even this time. Okay, so regarding the recall, we'll start with the official recall tomorrow. The first session is going to be radiology only. We are starting at 11 a.m. tomorrow with radiology questions ka recall. Right, so tomorrow 11 a.m. is when we would be starting there. Yes. Right. So, guys, I hope you all have made peace with however the paper was. I think you all have that satisfaction that I have given my best. I did the best that I could. I have no regrets whatsoever that कि मैंने मेरा best नहीं दिया. Right. So at least you are satisfied on that part, irrespective of how weird, how eccentric, or how difficult the paper was. Right. And all you can do now is just pray that the results are good. That too, even we would do for each one of you. I would do for each one of you, because definitely want to see you on the other side and get rid of this cycle very soon, so that you get to your next milestone. Right, so I think just we'll have to wait for the next 10 days and the results would be out, and I'm pretty sure that now you would start feeling a lot of void in your life. Abhi tak you were super busy, not realizing कि time kahan ja raha hai, but now it would be just the other way around. And you would actually be bored if you do not have anything to study, right? So just relax, enjoy, celebrate, spend time with your family and friends. You are not going to get this time again back where you would be absolutely free, like 24 hours kuch nahi karna hai, especially if you are not an intern, you are not working and all of that. And cherish these moments is what I would say. Yeah. So thank you so much everyone for joining in, and that was a quick review and the first impression on the NEET PG paper today. And please sleep peacefully tonight with all the contentment, and waiting to hear from you very soon with some good results, right? Thank you so much. Goodbye. Take care. And today I would not say keep studying, keep revising. I would definitely say keep relaxing and keep enjoying, right? Thank you so much, everyone. See you again tomorrow at 11 a.m. for radiology recall and the rest of the subjects recall also that we would be starting tomorrow, right? Thank you so much. Good night and take care.